So we're going to talk now about euthanasia and physician-assisted suicide. This is a hot button topic on occasion. Sometimes it rears up, something gets it going, and then sometimes we get a lull in the popularity of the discussion. So some of you may not be familiar with all of the cases, but we will revisit them, and of course you all know how to Google. All right, before we start, of course we need to talk terminology because there is a lot of confusion in everyday society about some of these terms. First, we're going to talk about degrees of brain injury. There are 3 degrees of brain injury that get mixed up: coma, persistent vegetative state, and whole brain death. A coma is a prolonged unconsciousness without significant brain damage. Coma is something people wake up from, okay? When there is something that has happened, there might be minimal brain damage that results in unconsciousness, but tests and so forth show that the brain, the whole of the brain, is still functioning. People stay in comas for varying amounts of time, but the coma is the thing somebody can wake up from. This is contrasted to the persistent vegetative state. In a persistent vegetative state, there is significant brain damage with permanent loss of consciousness. Okay? Notice the terminology here: loss of consciousness. What that means is consciousness is no longer present and cannot be restored. Okay? Loss there is a key word. A persistent vegetative state is something people cannot wake up from. Okay? They cannot wake up from it. There are, well, various parts of the brain, you all know that. But for our purposes, we're going to discuss the higher brain and lower brain functions. Okay? So we have higher brain functions and lower brain functions. Now, the lower brain functions have to do with the brain stem, okay? The brain stem is that thing that connects the brain to the spinal column and the spinal cord. The brain stem is what regulates our metabolic functions. So breathing, eye blinking, metabolizing food, okay, heart pumping. These are metabolic, these are the functions, the processes that keep our bodies, our physical bodies, working. The brain stem can still be functioning or functioning partially, while higher brain functions, consciousness, is gone. Okay? Consciousness, the thought processes, being able to consider what's happening, being able to stand up, control the body in such a way that I can make it move, these all happen in the higher brain, the cerebellum, the cerebrum. When these things stop, when there is significant damage to the higher brain, consciousness goes away. the brain is no longer capable of sustaining that. Okay? So when that kind of brain damage occurs, the person's not there anymore. The human being is there, but consciousness, person is gone. There is no recovering from that. There is no amount of time that can pass that can heal. It's just not there. And so persistent vegetative state, we often find people on respirators because maybe there was a little damage to the brainstem as well. Perhaps the heart's still beating and blood's still pumping, but the eyes don't blink and the lungs don't work on their own. That's a persistent vegetative state. Now, there have been other cases of persistent vegetative state where the brainstem works just great. And Terry Schiavo is our best example of that. Terry Schiavo was in a persistent vegetative state, but the brainstem worked so well that her eyes opened and closed, she didn't need any assistance in breathing, in her heart pumping, but she was not conscious. The higher brain had been so significantly damaged that there was no capability for her to think, for her to be aware, for her to wake up. Despite the eyes blinking, despite muscle twitches, Terry, was not there. She had a feeding tube that was sustaining her life because you still have to have nourishment. The body, the physical body, still needed nourishment. And so she had a feeding tube, she had IV fluids, but there was nothing else. So her body was functioning quite well, but the higher brain functions were gone. And as a result, her husband wanted to remove the feeding tube because he explained that they had had a conversation and she had said, "I would not want to live like this." Her parents refused to believe that she wasn't coming back. And so it went through the court systems and it was a well covered case by the media. And eventually the husband won out. They removed the feeding tube and she died. But she died of dehydration and starvation because there was no respirator. You know, usually if somebody's on a respirator, they remove the respirator and eventually the lungs stop working. But that wasn't Terry Schiavo's lungs were working just great. So she passed away and they did an autopsy and they confirmed that the higher brain was so damaged there was never going to be consciousness again. So the persistent vegetative state is that state where the person is not coming back. The human being may continue to live, but the person is not coming back. This is contrasted, of course, with whole brain death, where whole brain death is damage in exactly what it sounds like, the whole brain. There is no brainstem function, there is no consciousness. The whole brain has been so significantly damaged that it is not operating in any way whatsoever. Under these circumstances, you would need a respirator to keep your keep your lungs functioning, and you would need to be on bypass to keep your blood pumping, because the heart's not going to do anything. It's not getting any signals from the brainstem that tells it to function. Okay, so whole brain death is when there is no brain function of any kind. Does that make sense? Types of euthanasia. Euthanasia can be sorted into a number of different categories, and they can be mixed and matched. So first, let's distinguish between passive euthanasia, active euthanasia, and physician-assisted suicide. Passive euthanasia is stopping or withholding of potential life-saving or life-sustaining treatment. Passive euthanasia is when we remove a breathing tube, okay? When we remove the tube from the person in a persistent vegetative state and we let nature take its course. Passive euthanasia is when the person says, I don't want any more chemotherapy, I'm going to just let my disease run its course. Passive euthanasia is simply not doing anything, okay? Not giving the patient anything that is going to sustain or continue the patient's life, okay? Passive euthanasia is, largely speaking, legal and considered, most people consider it moral. There's a handful of people out there who don't, but generally speaking, people accept passive euthanasia as being acceptable. When we sign DNR forms, when we, remove the respirator, when we stop treatment, that's all passive euthanasia. Active euthanasia, by contrast, is where the doctor administers some sort of medication that brings about death. Okay? So if the doctor administers a lethal dose of morphine that brings about death, that's active euthanasia. Active euthanasia is what we do to animals when we put them to sleep, okay, or put them down. Although usually we say put them to sleep. Your dog or your cat has extensive cancer and there's nothing that can be done, and he or she is simply going to live the rest of his or her life in pain and agony. We tend to think that it's more humane to put them to sleep and spare them that. That's active euthanasia. Among human beings, active euthanasia, to the best of my knowledge, is not legal at all. The morality of it is really what our conversation is going to be about. Because passive euthanasia, like I said, is generally accepted. Physician-assisted suicide, which we're going to talk about in just a second, is becoming more and more acceptable. Active euthanasia is the meat of the debate. This is where we have a lot of controversy. So as we have this conversation, we're really focusing on active euthanasia. Physician-assisted suicide is when the doctor gives the patient medicine and the patient takes the medicine and ends his or her own life. And many years ago, there was a case of Dr. Kevorkian. Dr. Kevorkian and his so-called death machine. Dr. Kevorkian set up a machine that administered medication for the patient to end his or her own life. The patient pushed the button that administered the drugs. This was highly controversial at the time. And there was a lot of talk about what he was doing. Was he killing these people? Legally, and remember, legality and morality are in fact separate things, but legally they tried several times to convict him of murder, and they were never able to get a conviction because he didn't press the button until the last time when the patient had deteriorated to the point where I think he could not press the button and administer the medication, and Dr. Kevorkian did it for him. And he did it on tape. And as a result, that's active euthanasia. It's no longer physician-assisted suicide, and the court system was able to convict them. Physician-assisted suicide has gained in popularity. I mean, not as in everybody goes around doing it, but it's more acceptable. There are a number of states that allow for physician-assisted suicide now. It was legal in the Netherlands, I think. For quite some time, there were very strict guidelines that were set up, and many of those guidelines are in effect in the states that accept it. Guidelines like you have to have 2 separate doctors confirm the diagnosis. You have to have 2 separate doctors hear the patient say, I want to die. You have to have, I think, maybe a psychological evaluation, at least in some cases, to confirm that the patient isn't merely suffering from depression that could be treated and the patient wouldn't want to die anymore. So there are a number of conditions that have to be met, but the idea that the patient can take his or her own life has become more acceptable. Not universally, but more acceptable. So we don't talk about our conversation will not be as much about physician-assisted suicide. Okay, more types of euthanasia. Regardless of whether euthanasia is active or passive, it can be voluntary, where it's the patient's decision to end treatment, or it can be non-voluntary, where somebody else decides to end treatment. So voluntary euthanasia is when the patient makes the decision. The patient signs a DNR, do not resuscitate form. The patient decides to no longer have chemotherapy. The patient decides to get the prescription from the doctor, although that's not euthanasia, that's physician-assisted suicide. The point is that voluntary euthanasia, the patient is making the decision. Non-voluntary euthanasia is when somebody else makes the decision. This happens when somebody is in a persistent vegetative state and can't make the decision, so a family member has to decide whether the respirator is going to be turned off. Children who are receiving chemotherapy or other life-saving treatment and the parent decides to cease treatment, that's non-voluntary euthanasia. Typically in non-voluntary euthanasia, the patient is unable to make the decision him or herself, either because of age or because of loss of consciousness. There is another kind that I will just mention for the sake of the distinction, and that is involuntary euthanasia. Now, involuntary euthanasia is against the patient's wishes. Patient's wishes. Okay, so I don't want to die, and yet somebody gives me a lethal dose of morphine. Okay, I want to continue to live, but I am refused treatment to continue to live. Everybody says involuntary euthanasia is wrong. Okay, universally, involuntary euthanasia bad. Okay, so involuntary euthanasia, I tried to make that red. What happened? Okay, involuntary euthanasia, it's bad. So that's why I didn't put it on the slide. But for the sake of distinction, to help you understand non-voluntary, I show you involuntary. Okay, so non-voluntary is just when the patient is unable, and I don't mean just emotionally distraught, I mean loss of consciousness, 3 years old, okay, unable to make the decision him or herself, and so a proctor does it for him. Usually that is a family member, parents in the case of children, spouses, next of kin in the case of, older grown-up individuals. Every once in a while, somebody, maybe doesn't have anybody and they designate an individual to be their medical proctor. But more often than not, it's next of kin. Make sense? What all of this means, I said that it could be mixed and matched. So we can have voluntary, oh, I'm still in red, voluntary passive euthanasia. We can have voluntary active euthanasia. We can have non-voluntary passive euthanasia. We can have non-voluntary active euthanasia. Okay, so active and passive euthanasia in and of themselves are not voluntary or non-voluntary. Okay, active euthanasia is just the kind of euthanasia where the doctor administers the medication to the patient. Passive euthanasia is just when medical treatment is withdrawn or withheld. They can be voluntary or non-voluntary. Okay, so active and passive are then split into voluntary passive, non-voluntary passive, voluntary active, non-voluntary active. Does that make sense? Okay.